Hello and welcome to EduSeries presentations by Cycle Technologies. We discuss topics in family planning and reproductive health with experts in the field. This episode is a question and answer follow-up webinar on the two-day method of family planning. Our listeners may already have viewed our informational session in which we describe the method in detail and have posted on the Cycle Technologies YouTube channel. For this Q&A session, we have asked people to email us their questions in advance, which we will answer here, as well as other questions that we've received about the two-day method. For the webinar participants, please note that you are muted and we can't hear you and you cannot hear each other. If you have a question during the webinar that maybe you didn't get the chance to send to us in advance, please type it into the question box and submit it. And we'll get to those questions at the end of the presentation as time permits. Please also note that this webinar is being recorded and will also be posted on the Cycle Technologies YouTube channel. So before we get to the questions, let us first introduce ourselves. This is Ann Mullen from Cycle Technologies, and I'm happy to have with me Dr. Victoria Jennings from the Institute for Reproductive Health at Georgetown University. Hello, Dr. Jennings. Thank you for joining me.
Hi, Ann. It's my pleasure to be here. Thank you very much.
Dr. Jennings, you have many years of experience with fertility awareness methods and have led your research team at the Institute in developing new methods, including the two-day method, which we'll be talking about today. So I'm very glad you could participate and lend us your expert knowledge. A question that I have before we go to our other questions is, what inspired you to create new fertility awareness methods?
We are really trying to meet the needs of women who want to use a method to avoid pregnancy or to achieve pregnancy that is non-hormonal, non-invasive, that really works with their bodies. Our criteria include, for example, that a method be very effective and that it be very easy to use. So by the time you combine effective, easy to use, and natural, that's really what drives the work of the Institute for Reproductive Health.
Well, that's very exciting, and we at Cycle Technologies have been excited about these methods and have had a wonderful collaboration with you and Institute to help make them available to women worldwide. So specifically to the two-day method, in my previous session with your colleague Jeanette Pichon, we discussed in detail how the method works, but I think it would be good to do a quick review of the method here for the audience. Here on the screen, we have the diagram. Dr. Jennings, could you please briefly explain the basics of the two-day method?
Certainly. The two-day method is based on the fact that there are secretions that are generated throughout the menstrual cycle by shifts in hormones that occur during that cycle. You'll remember that a menstrual cycle, of course, begins the day that a woman starts her period and ends the day before her next period begins. But during that time, many things are going on in her body, and secretions are produced as a result of those hormones at precisely the time that a woman that pregnancy is likely, when it's possible for her to become pregnant. So the two-day method, based on that fact, essentially involves a woman asking herself, did I note secretions today? If the answer is yes, she can get pregnant today. If the answer is no, she asks herself a second question, did I note secretions yesterday? If the answer to that is yes, she should consider herself fertile today and assume that she could get pregnant today. But if the answer to both of those questions is no, I did not note secretions yesterday and I did not note secretions today, then pregnancy is not likely today.
Well, thank you for that overview of how the method works. It's certainly a simpler approach to your fertility signs and using that to plan or prevent pregnancy. I'd also like to review the TwoDay Method app for iPhone, which is the practical way to use the method. It applies the flow of questions that you've just explained and is easy to use. So here on the screen, we can see that a woman using the app is first prompted for her observations of the day. So she's asked, have you seen any secretions today? And she can tap on yes, no, or I have my period, or I don't know. And then the app applies the algorithm and shows her risk for pregnancy today with a view of how she answered yesterday as well. So what you were talking about, those two questions, they're shown right on the app. And then she has the option to view her days over time on a calendar and also to keep a history of how she's answered. So many of the questions that we've received about the method have to do about secretions and how to check for them and how to identify them. So Dr. Jennings, perhaps you can help me with these. The first one, which is kind of an obvious one, but people have asked, what do you look for when you're checking for secretions?
That's a very interesting question. And most women actually do notice their secretions. They may not know that their secretions are a sign of fertility, but they are aware of when they have them and when they don't. So for most women, it's really almost a non-question. What do you look for when you're looking for secretions? Because the answer is you look for any kind of wetness or any kind of flow from the vagina that is different from what you would expect, for example, when you urinate or something of that sort. So these kinds of secretions are exactly what you're looking for.
So when a woman is checking for them, when should you start checking?
Well, during the menstrual cycle, she should start checking the day after her period ends. The first day she doesn't have any menstrual bleeding, she should absolutely begin checking for her secretions. Mm-hmm. There's another answer to that question as well. When should she start checking for secretions? Some women actually check every time they go to the bathroom, or they just sort of think about it from time to time and notice the feel of wetness that would tell them whether or not they had secretions. But in terms of actually using the method, our recommendation is that at a minimum, a woman check twice a day, in the afternoon and in the evening before she goes to bed.
So the answer to when can be when during your cycle and when also?
When during the day.
When during the
yes.
day. Mm-hmm. Okay, so let's go on to the next. How should you check for secretions?
There really are three ways that women check. One is that you can see secretions. You can see them in your underwear. You can see them on toilet paper. And it is a sort of a shiny appearance of a wetness, and those are your secretions. So that's one way. Another way is to touch. A woman could, for example, touch herself at the vulva, and if there is wetness there, she has secretions. A third way is simply the feel. Many women, particularly after they've gotten used to checking them by either seeing or touching them, are just able to feel when they have a little bit of wetness in the vaginal area around the vulva. They can even feel the secretions when they're still inside the vagina, just a little bit of slipperiness and wetness.
So once you know what to look for, it seems much more obvious, and maybe it's a routine
right.
kind of thing.
So many people begin by wanting to see them, and then they might say, oh, now I understand that. I don't even have to look anymore. I can tell.
Mm-hmm. Now, another question we've gotten, and I think probably from persons who are familiar with other fertility awareness methods.
Mm-hmm.
Of course, there's other very effective fertility awareness methods that take other symptoms into account. So the question was, why doesn't the method, the 2-day method, take changes in secretion into consideration?
Well, it's a very good question because, as you just pointed out, there are other fertility awareness-based methods that ask a woman to really look at her secretions every day and analyze them in the sense of, are they slippery, are they stretchy, mm-hmm. are they crumbly, etc., and to actually write that down and absolutely to take all of that into consideration. But our research has shown that in terms of actually as an indicator of fertility, it doesn't matter what the secretions look or feel like. It's the presence or absence of the secretions that makes a difference. Many women who are checking their secretions will certainly, in fact, notice that there are changes over time throughout the cycle. They're definitely not the same every day. It's not like, oh, you have 6 or 7 or 8 or 9 days of secretions all just alike, and then now you don't have them anymore. There definitely are changes. But if what you're interested in is whether or not you're fertile that day, it simply doesn't matter for purposes of knowing about your fertility.
And what about the amount of secretion? So you might see maybe a little bit more or less. Does that matter? Just as
it
you
doesn't
say,
matter.
It doesn't matter.
It doesn't matter. If you need to consider yourself fertile if you have any secretions at all.
Well, that seems pretty straightforward. Now, another person wanted to know about when she has her period. So what about my period, and how does the method treat days of menstruation?
Well, according to the algorithm, you might say, or to the rules of using the 2-day method, menstruation is treated as a time of extremely low fertility or non-fertile days. But as soon as your menstrual bleeding stops, whether your period is 4 days long or 6 days long or even more or even less, the day that you don't have bleeding, you should begin checking for your secretions because the potential is there for you to be fertile.
Okay, so the next one, do medications affect secretions?
Certainly some medications can. Antihistamine, some kinds of antibiotics, some types of steroids, etc., can affect secretions. So women who are using them, let's just say that a woman has been using the 2-day method for 3 or 4 months, and she needs to take an antibiotic for a while. She's going to notice some difference in her secretions. But regardless, the presence or absence of secretions is what is going to tell her whether or not
So
she's
even if
fertile.
they're affected, if they're there,
she's fertile, or she should consider herself fertile.
Okay, so what if you forget to check for secretions?
Well, you should just go and check right now. No, if you forgot yesterday, for example, you say, oh, I don't remember, I forgot to check yesterday, then just to be conservative, you should assume that yesterday you had secretions. Just consider that perhaps you did. But if you forgot to check today, go and check.
Okay,
because
so
it's never too late to check for secretions.
So if you did check yesterday and today you have forgotten, but remember at the end the day, it's not too late. Just go check. Okay.
Exactly.
All right. I have another question to add to the secretion one. So if someone's using 2-day method, about how many days can you expect to have secretions? So
very good question. Actually, we recommend that if a woman observes secretions, if she feels that she has secretions less than 4 days of her cycle, that a couple of things might be going on. One is that she just might have a great deal of difficulty detecting them for whatever reason. Another possibility is that she's not ovulating and that her hormonal production is not sufficient to produce the secretions that would be an indicator of her fertility. So she might want to go and check on that. It's not necessarily the case that if it's 4 days or less of secretions that she's infertile or that there's anything wrong with her, but it's just something, it's kind of a flag. Something to be aware of. And if her secretions go on for more than 14 days, our recommendation is, again, go talk to your healthcare provider because, as you know, there are some kinds of infections that produce a flow from fluid from the vagina that a woman might confuse with secretions, but they would not be cyclical. They would be continuous. So if she continues more than 14 days, she needs to go and have that checked out just to be sure or to get treatment if she does have some kind of an infection, or to be sure that it's not an infection.
Well, that is certainly good information to know, too, if there's something going on. But it sounds like from what you're saying, anywhere between 4 or 5 to maybe 14 days could be a range for a woman.
But it tends to be around 10,
okay.
9 or 10 days during the cycle that she's going to have some kind of secretions. For some women, it's less. For some women, it's a little more. It depends on what's normal for you. It's not a thing to worry about one way or the other. But if you have very few days, or if you have a lot of days, it's just a good idea to check it out. It's good reproductive health to go check with your provider.
So fertility awareness, you're being aware.
Absolutely, you're being aware.
Okay, so the next questions, we didn't have too many about this, but I guess we consider them special circumstances. So if a woman is on a method of birth control that's hormonal, like the pill, but she wants to use the 2-day method, is there something she should know? Can she use the 2-day method if she's been on hormonal contraception?
Yes, she can, but there are certain caveats to that. If she's recently stopped using the pill, first of all, don't try to use the method while you're still using the pill. You're using the pill, and the pill itself is hormonal and is going to affect the cervical secretion. So you're not really going to be able to detect anything at all about your fertility if you're using by looking at your secretions. Nor do you need to for the purpose of avoiding pregnancy if you're using the pill. But if she has stopped using the pill, then we recommend that she has a period, at least one period, after stopping using the pill before she starts using the 2-day method.
Okay, so as soon as she's menstruated, she can consider using
as soon as she has menstruated. Now, one thing I think to keep in mind is that when she goes off of the pill, she's going to have a bleed. She's going to bleed, but that is not really a period per se. That's just bleeding as a result of having stopped taking the hormones. So she needs to have her period before she starts using the 2-day method.
So that could be an entire cycle, maybe?
It could be an entire cycle. She can use it, but she's unlikely to have the same kind of pattern of secretions during those days after she has stopped taking the pill that she will have once she's actually had a period.
And she might want to protect herself between while she's in that transition time?
Yes.
Okay, so another one that's sort of similar has to do more with postpartum situation, or if you're breastfeeding. Can you use the 2-day method then?
Well, breastfeeding, of course, isn't just one thing. There are women who are breastfeeding frequently, let's say a very young infant, and there are women who are breastfeeding a 9-month-old twice a day. Those are two very different kinds of breastfeeding. But as we do know, breastfeeding has an effect on fertility, it has an effect on the woman's hormones, and it has an effect on secretions. So again, if you are postpartum and you are breastfeeding, we recommend that you have, first of all, that you have started your period again, and that you then recognize that you may have a fairly long, a greater number of days with secretions during your first cycle or two than you will have later on once your cycle regularity has returned.
And so is there a similar sort of advice when you're transitioning, using a different kind of method maybe, or condom or something? Or
certainly a woman during her first cycle or two may want to monitor her secretions just to sort of see how her cycle is coming along, and use another form of protection during that time. But other women are going to say, you know, I'm not breastfeeding very much, and my period is back, and I would like to use this method. She just needs to recognize that she's going to potentially have a greater number of days with secretions than she would have normally, and that those secretions during that period of time may be more related to her breastfeeding per se than they are to her actual fertility. So she may get a number of days that we might call false positives She thinks she's fertile, but she's not.
And she'll probably just be more careful then.
Right.
Anyway.
It's a question of the number of days.
Okay. Well, those are really all the questions that we had about the actual method. The other questions that we received had to do about the iPhone app. The first one that we got was, how can I download the app? Which is pretty straightforward. You can go to the Apple App Store or iTunes. Also, if you go to the TwoDayMethod.com website, which we'll show this later in the presentation for you to go to, there's a link straight to the Apple App Store where you can download the app. And the app is free. Someone asked, is there a cost? It is a free app. A question that we got from a number of people is there an Android version? And so far the answer is no, there's not an Android app yet. We are looking into it, but currently it's only available for iPhone. And finally, someone wanted to know, okay, so I don't have an iPhone and there's no Android app. How can I use the method if I don't have an iPhone? So Dr. Jennings, maybe you can help me answer this question. Does she use her calendar, or what's a good way to use TwoDay Method without the iPhone app?
Well, I have to say I am first of all, I'm very impressed with the app. I think it's just the easiest way possible to use this method. But that certainly doesn't limit use of the method to women who just have an iPhone. It's a method that women around the world are using, women who have no phone whatsoever, I might point out. That's a shrinking number of women. But essentially, a woman just needs to be able to have some way of keeping track of whether she had secretions yesterday and to note whether she has secretions today. Some women can do that by memory. They don't even need to write down a thing. But many women prefer to do something like go to a calendar and just make some kind of a mark every single day to say, I checked today and I didn't have any. I checked today and I didn't have any. I checked today and I had them. So it's a question of being able to keep track. That's really what's important. And of course the app does that for you, which is what makes it so easy. It just sort of calculates everything for you so that you can figure it out. Yes, you have to enter it, but it's a tap. But this is it's a very...
so it sounds like anyone can use it, really.
Anyone can use it. It's not necessary to have an iPhone to use it.
Well, that's certainly good to know. So now that ends the advanced questions. I did mention at the beginning that if someone had questions, they could submit them during the presentation. So if you bear with me a moment, I'm just going to check to see if we have any questions. Well, one person did have a good eye when it came to the app, so there was the option for don't know, meaning have you observed any secretions? So we had yes, no, have my period, and then don't know. The question to that is the app will default to the conservative status. So Dr. Jennings, you mentioned before, if someone forgot to check yesterday, you just consider yourself fertile. Isn't that
right?
Right.
Right. And you can imagine also that there might be a circumstance in which a woman has said, I'm just not sure. I thought I felt something, but I'm not sure. I thought I saw something, but now I'm not sure. So not sure or don't know. Just to be on the safe side, you need to consider yourself fertile that day.
Okay, so, well, that's a good question and good to know. So we didn't have any more questions submitted just now. So that ends our Q&A session. Thank you for joining us. If you do think of anything afterward or if you have any comments, please contact us. So up on the screen you can see we've got our telephone number there, regular telephone and toll-free. You can send questions via email to info@cycletechnologies.com. And then also there is the TwoDayMethod.com website, which I mentioned earlier, and there is an extensive Q&A there as well. So if you wanted to take a look there, you can certainly do that. Visit us on Facebook, or you can follow us on Twitter. And then also going forward, please take a look at the Cycle Technologies YouTube channel for other topics on family planning and reproductive health. This is Ann Mullen from Cycle Technologies with Dr. Victoria Jennings from the Institute for Reproductive Health, saying thank you for joining us and goodbye.
Goodbye, Ann. Thank you for having me.
You're welcome. Bye-bye.